I'm very happy to be in Ghana, and also I'm very, very happy to be especially in Kumasi, and on the top of that, collaborating with KCCR. And KCCR is one of 11 teams in the ADAPT network, and this 11 team is coming together, working together only for one important goal: to combat AMR and make an pan-African strategy, how to work together, how to collaborate together to make the future for the next generation free of AMR. This is one of the main goals we are planning. The most important thing of this project is training young researchers and young generation, which will be the future leader of Africa, in order to work as a scientist in the industry, in order to be sure to have this continent free of AMR and to have a very good strategy for combating the AMR. So our network is about prevention. We are not waiting until the problem is happening. We are only working together to combat the problem before it starts. And that's our goal in ADAPT.
So we've convened this meeting to bring all these partners together, basically to share ideas, to do an overview of what we've done in the last 1 year about the project. So principally our role in Ghana is we are leading one of the, what you call the tax or the research work packages for this project. So our tax is developing diagnostics for rapid detection of AMR. So part of the plan is to be able to develop new tools outside the traditional way of detecting AMRs. The traditional system is quite laborious, laboratory intensive, and so we're trying to develop simple methods that we can use to augment what we already have to be able to detect AMR. So our role in this project is developing diagnostics to support the surveillance of AMR.
Previously, the approach had been to focus mostly with the doctors and those who use antibiotics in the clinics. But obviously now we know that it goes beyond the hospital into the environment. So the most appropriate way of combating this is the antimicrobial stewardship with the One Health approach, which includes activities on the environment, activities in animals, activities in fisheries, and then of course activities in human health. So with a coordinated approach in this way, we hope to curb the menace of antibiotic resistance.
My presentation was about antimicrobial resistance and antimicrobial susceptibility testing, because it's important to evaluate the resistances in a bacterium. Yes, and so the workshop was on the method called diffusion, and yeah, this is a common method applied in microbiological labs.
We had a super successful meeting. It was really important to get together all again and to share our knowledge which we have collected in each country. The first 2 days were conducted to the young researchers, and I think everyone had fun and learned a lot, and the last 3 days were really important to keep everyone updated on the latest results and also the challenges which each country is facing, because I think we can learn a lot from each other.
As also young researchers, we are the motor of this ADAPT activity, as we are the one who go on field, collect samples, and come take and laboratory activities and translate them or report them as results that can be utilized on papers or to display the results in the community or even in all the stakeholders and policymakers, so that decision can be taken to tackle AMR in our country.
From Monday, we've learned a lot of new innovations about antimicrobial resistance, because start kicking on Monday, we learn on the surveillance of about antimicrobial resistance, what it is, how does it spread, and how to curb it. And this program also has also availed us the young scientists to learn various genomics and metagenomics data sequencing.